When performing a history and physical exam, it is important to knock before entering the room. Introduce yourself as a physician assistant student and verify the patient's name. Be sure to maintain eye contact. Then confirm and clarify the purpose of the visit with the patient. And lastly, wash or sanitize your hands. Moving on to the history of present illness, the HPI. To build a rapport with your patient, it is important to sit at eye level and maintain eye contact. Engage with the patient with a friendly greeting. Be sure to focus on the patient and not on your computer or your notes. And be aware of personal nonverbal cues such as your body language, toe tapping, etc. Moving on to the HPI, we tend to use a mnemonic called locates. When performing these set of questions, make sure they are open-ended to gain information about the chief complaint. The L in locate stands for location. For example, the questions you want to ask are, where does it hurt? Does it radiate? Next is O, other associated symptoms. What else happened when it occurs? C stands for characteristics. What does it feel like? Is it sharp? Is it dull? Does it tingle? Things like that. A stands for aggravating and associating factors. What makes it better or what makes it worse? T is for timing. When did it start? How long have you been dealing with this? Is it constant or intermittent? E stands for environment and setting. So where did this happen? What were you doing at the time? And lastly, S stands for severity. How bad is it? On a scale of 0 to 10, 10 being the worst, how would you rate the pain? Next, after you finish your mnemonics of gaining the information, you want to ask some yes or no questions about common symptoms related to appropriate body symptoms. Think of it as a focused or pertinent review of systems regarding their current problem. Then you want to ask yes or no questions about constitutional symptoms. Those are fever, chills, weight changes, fatigue, and night sweats. Then move on to ask about current medications. This includes over-the-counter meds as well. It is important to ask how much they take, how often, as well as the reason why they take it. Lastly, ask if they have any medication-related allergies and what kind of reaction they experience. This concludes the history of present illness. So now you need to include a transition sentence before you move on to the next part of your exam. An example would be such as, I think I understand your current problem, so now I would like to learn about other health problems you have had. Now is when you move on to your past medical history, the PMH. When asking the patient, bring up chronic illnesses. Ask if they have any current conditions or previous conditions that they are aware of. It is important to also include behavioral health issues. Then you can move on to other problems that are being treated for or any recent healthcare visits. You can ask if the patient is currently being treated by another provider, and if so, what are they being treated for? Then move on to hospitalizations. Ask the patient if they have had any hospitalizations. If so, be sure to ask when, what it was for, and where they were hospitalized. Moving on to surgeries, ask if they've had any previous surgeries. And again, you would want to obtain the information of what it was, where it was, when, and who performed it. And then for female patients, you want to ask about their OBGYN history. It is important to ask when they started menarche, when was their last menstrual cycle, have they had any pregnancies, births, or miscarriages, and also if they mention any concerns about their cycle, it is important to make note of that. Moving on to preventative care to ask about, such as immunizations and screenings. Immunizations, you can ask if they are up to date and if they've had their Tdap or their flu shot or their Gardasil injection. Just be sure that it is age-related when you ask about those. Moving on to the screening test, for example, if the patient is female, when was their last pap smear? If they are male, you can ask about STD screening if they're young, or when was their last colonoscopy if they're older. Some other general ones to ask about for every patient is when their last eye exam and dental appointment were. And that concludes your past medical history. Now you want to do another transition sentence. An example could be, now that we have talked about your health history, I would like to find out more about your family's health history. And this moves into the family history section. Family histories should cover 3 generations. For a patient without children, this would include siblings, parents, and grandparents. For a patient with children, this would include children, siblings, and parents. Primarily, the family history is limited to first-degree relatives, except for the grandparents. Obtaining a family history may be an emotional trigger for the patient, therefore be clear about why you need this information. Family history may also influence preventative or screening measures recommended for the patient. It can also identify rare conditions to add to the provider's differential list and allow for recognition of a common disease early on. An example that you could say, tell me about your dad. Do they have any health problems such as heart disease, diabetes, asthma, or any forms of cancer? And at what age were they diagnosed? You also want to keep in mind if a family member is deceased. Include the cause of death and the age of death. If the patient is adopted and unsure of the family history, just document the patient as adopted. That concludes the family history section. Moving on to the social history, the transition sentence you would want to use is, now I would like to get to know you better by asking a few questions about your home life, work, and habits. Within the social history, it is an attempt to learn who the patient is as a person. It should tell you their characteristics and lifestyle. The information obtained from the patient will identify if it contributes to the cause of illness, aggravates, or limits the severity of the illness, and whether it interferes or helps with getting well. When asking about sensitive topics, it is best to be direct with your questioning that requires a single word answer. Show the patient that you're comfortable asking the questions, and this will increase their comfort in responding. Avoid passing judgment or making assumptions. Explain why the information is important, and lastly, always act professionally. Within the social history, it is good to just start with their home environment. Ask the patient where they live. Do they live with anyone? Or do they feel safe in their home? Next, you can ask about employment or school. Ask, what do they do for work? Where do they work? Is their job sedentary or labor intensive? Do they like their job? And in regards to school, where do they go to school? What grade are they in? Moving on to substance use or abuse. It is important to ask about tobacco use, such as cigarettes, e-cigarettes, and tobacco chewing. Regarding alcohol use, it is vital to ask how frequently they drink, how much, and even what they drink. And then also ask about illicit drug use. Again, be sure to ask what they use and how often. Moving on to diet and exercise. When asking about a patient's diet, you can check if they follow a particular diet or simply do they feel they eat a variety of foods. Also, how much fast food do they eat, or how many times a week do they eat out? With exercising, you want to ask how much they exercise and even what they like to do for exercise. What do you do for exercise? How often and how much? Moving on to marital status and significant other relationships and support systems. Ask the patient, what's their marital status? Is it married, single, widowed, or divorced? Do you have a spouse, partner, or significant other? Be mindful of the language you use. Is their significant other male or female? Do you feel like you have a good support system from a family member or from friends? And who do you rely on for most of your support? Moving on to sleep. You can ask the questions such as, how many hours of sleep does the patient get? Do they feel well rested when they get up? Then you can ask about stress. Ask the patient about stresses in the life and how they cope with that stress. Is your life particularly stressful right now, or is there something causing you increased stress? And how do you handle it? And then moving on to sexual history. This can be uncomfortable to ask about with your patient. Therefore, make it seem like a common thing you ask everyone. You can phrase it like, to fully understand a patient's health, I routinely ask about sexual health and habits. Are you sexually active? How many partners have you had in the last 6 months, 5 years, or a lifetime? Are your partners male, female, or both? Do you practice safe sex with forms of contraception? Do you have any concerns about HIV or AIDS? It is important to be alert to clues regarding physical or sexual abuse as well. Then you can ask about safety issues. Does this patient wear a seatbelt? Do they text and drive? Are there smoke detectors in their house, and are they working? And that concludes the social history. Now you want to do a transition sentence to move into your review of systems. That could sound like this. Lastly, I'm going to ask you a series of yes or no questions that target different body systems to uncover any potential significant problems or symptoms that were not mentioned. These are symptoms that you have or have not experienced in the last 2 weeks. The review of systems is an inventory checklist with a head-to-toe approach of specific body systems. It can be used comprehensively or be more focused. You simply ask about possible symptoms the patient can feel in each system. Starting off with the general constitutional symptoms, which you may have already asked in the HPI, but I'll go ahead and repeat those for you. They include fever, chills, weight changes, night sweats, and fatigue. Then you simply just want to go head to toe, starting with the head and eyes. Do you have any headaches? Are your eyes itchy or red? Then move on to ears, nose, sinus, mouth, and throat. Are you having ringing in your ears, a runny nose, a sore throat? And they would simply respond with yes or no to each of these. It goes pretty fast. Moving on to neck and the lymphatic system. Are you having any neck pain, swollen lumps in the neck region? And then for females, now you would want to ask about breasts. Are they having any nipple discharge, lumps, or indurations? Then you can go on to respiratory system. Are they having any difficulty breathing? Are they coughing or experiencing short of breath? Next is cardio in the peripheral vascular system. Questions could include, are you having any chest pain, palpitations, or cyanosis in your extremities? Then move along to gastrointestinal. Are they experiencing any nausea, vomiting, or diarrhea? Move along then to your genitourinary and reproductive system. And with the reproductive system, of course, you want to focus it to whether the patient is male or female. You could ask questions, are you having any burning or discharge? Next, move along to the musculoskeletal system. Are you having any joint pain or swelling or muscle pain? Next would be neurologic. Is the patient experiencing any dizziness or weakness? Psychiatric. Are they experiencing any anxiety, depression, thoughts of hurting themselves or other people? Then we have hematologic. Are they having any easy bruising or clotting? And lastly, endocrine. Are they experiencing any heat or cold intolerance or excessive thirst or hunger? And that concludes all of the questions that you'd be asking the patient. So a transition sentence that you could use would be, that concludes all the questions. Now I'm going to get your vitals.